So hey everyone, it's the Ben and Gary Show. We know dentistry, and we're here to be able to answer your questions as they come up. And we had a really good one that came up just recently that was in reference to an individual said, "What's the best way to be able to put my crown back on if it ever comes off and I'm not near a dentist?"
Right.
You know, and I can understand how frustrating that can possibly be. Gary, what do you advise your patients on, what to do when that happens and they're not and they're remote from you?
Yeah, especially when they're traveling. That's usually when it happens.
A hassle.
But if the temporary fits well, I mean, if there's good mechanical retention, then I just tell them to put a little bit, dab of toothpaste in and put it in, and the suction will help pull it in place. But the key is they have to know they have to do it first,
try
it and make sure it's oriented in the correct position before they try that. So, but with toothpaste, it's not really a big deal. Right? I think if you get it wrong, you just try it again.
Yeah, there's no setting time on it there. That if you don't get it in there just right, that you've lost your chance to do it, and you've taken a couple of steps backwards.
But if they go to a drugstore and find some type of temporary cement, then you want to make sure that it's oriented correctly before you put the
definitely want a trial run to know exactly how to, when you pick it up, to how to put it into place so that because there is some sort of some working time that you have that usually there's enough time. And these are not necessarily designed to be perfect, but I've certainly recommended some of those over-the-counter drugstore, CVS, Walgreens, Walmart.
But the temporary crown is only going to go in one way, and you can check with your bite to make sure, but don't bite too hard in case if it doesn't line up, then you don't want to fracture the temporary.
God forbid you fracture the tooth.
Yeah, and then you don't want to overfill the inside of the crown, so just put a little bit in and pop it in, and it'll stay right in place.
So why wouldn't you want to overfill it?
Oh, well, because then you have all this excess material that oozes out and stays on the gum tissue, and it's going to irritate the gum tissue with time. So, or unless you can remove some of that carefully.
I would think it would be sort of challenging to do it that way. Because you have to keep it dry. I mean, it's this is not a perfect. This is just to be able to kind of get you over the hump until you can get back to your dentist so they can put it in properly. But hopefully it's not sensitive. And if something is broken though, if it doesn't really go back into place, what's been your recommendation for somebody like that?
If it doesn't go back into place,
or if it's somehow it's damaged and then doesn't fit,
then really just leave it out. You don't want to force it in because it's not gonna serve you. It's gonna throw your bite off. And, nothing good is going to come out of that one.
No.
But let me backtrack. So if the temporary crown is out, the one thing you don't want to do is use superglue to put it back in.
Oh my gosh.
That makes a big mess.
That makes a big mess. I mean, there's a couple things here I think that could go wrong. I mean, even if you're trying to put it in your hand, if you get any superglue on your fingertips, you'll never get your fingers separated from that crown in time enough. In fact, you'll probably have to sit there with your fingers stuck to the crown.
But patients have come in having done that, so I just throw that out there just so you don't want to try that.
And cleaning all that off again and having everything fit back together again is a process, and sometimes it just doesn't really work. And by using super glue, you kind of make it worse. And it's not just about doing something silly like gluing your fingertips together or getting it on your gum and irritating it. But it's just when we come to our turn to be able to fix it, it's harder. And sometimes you have to start all over again.
But the second thing I would say is that you definitely want to get to the dentist as soon as possible, because if you leave the crown out, the adjacent teeth can move a little bit, and when it comes time to put the temporary back in, if you wait a week, then it may not go in quite so easily. And
the tooth itself can move.
Right. Yeah, it can super erupt, and so that means that it will come up a little bit higher. So when they go to put when we go to put the permanent crown in, we have to shave off the biting surface and adjust the
Sometimes the tooth that's biting against can also drop down or rise up.
So teeth are not static. They don't just sit there.
They're dynamic.
They will move.
You know, if they weren't, you know, orthodontists would be out of business, and there'd be no Invisalign, Smile Direct, and all the above that's out there.
Oh yeah.
So teeth will move, and people are like, oh, it's only been out for like a week. Well, that's a long time. You know, and in our world, you know, a tenth of a millimeter is a lot.
Yeah, it's a big deal.
And so if it moves that much, it's not about just kind of popping it back in and expecting it to be fine. Yeah. It can be a problem. Yeah, going forward for sure.
So if patients have also lost fillings, and I know there are things on the market in the dental store, drugstore that you can find that you can use to kind of fill in.
Right.
It's
like Dentemp, or I can't remember exactly all the different names that they're out there, but your pharmacist can recommend you as to which way to go. But usually you just go right to the section with all the toothpaste and toothbrushes and what have you, and you can find what you need. Yeah. And make sure you read the directions. Right. I mean, they're definitely important. I know some people who throw those directions out as soon as they open the package. And that's not good, because you know, a lot of times you only get one shot at this. And lastly, I would say, you know, another way I've also told individuals is that you can use a little bit dab of denture adhesive inside of a temporary crown. That's another one. Like the pink poly grips and the Fix-A-Dents. Again, you only want to use a little bit of this, and if you put a pea size inside of it, that's a lot. So we're looking at a fraction of that to go inside of a temporary crown to be able to help keep it in place. So now you have toothpaste you mentioned. Yeah. We've got a little bit of denture adhesive, and then you can also potentially go to the drugstore and get one of those sort of do-it-yourself cements that are there to act as a temporary way to be able to fix it in place.
That's a great idea. Yeah.
So
the last thing would be if the tooth actually fractures.
Oh boy, yeah, that's.
And you get a sharp edge. You know, that can be painful, especially when you're eating, and irritates the tongue.
Yeah, yeah.
So, you know, we have told patients when they have braces to use wax. So that, again, you can get at the drugstore, and so you just pop it in, cover that area, and although you can't eat with it in place, but you can afterwards, you can put that wax in and cover that site, and that helps a lot.
Correct. So, yeah. Well, hopefully there's some ways for you to be able to kind of do it yourself when the dentist isn't around, and sort of get you over the hump until you can get back to your dentist. These are just some ways. Hope that helps. Yeah. This is the Ben and Gary Show. We know dentistry. Right. See you next time.
Bye.